Okay. My name is Isaac Kabongo, the Executive Director of Ecological Christian Organization. As always, this program or podcast is brought to you by Ecological Christian Organization in partnership with Marathon Advertising. And we are happy that we have this session of young people. And during this session, we shall be discussing a very critical and a little bit controversial topic. This topic relates to the issues to do with climate change and sexual and productive health in the opinion or perspective of the younger people. We know that Africa right now has a very interesting potential of the younger people because the transformation we are looking at having will only become meaningful when the young people are part and parcel of every decision making we make. And therefore, we can't talk about climate change without tapping into the potential of the younger people. But also, we can't talk about population dynamics, the nexus between population dynamics and climate change on the continent without, again, bringing on board young people. The slogan has been over time that younger people have always been telling everyone that no decision for them without them. And that's why we, as Ecological Christian Organization in partnership with Marathon Advertising, we believe that bringing on board young people to discuss issues to do with climate change and the nexus between climate change and the health, sexual and reproductive health is critical. And that's why we are here. With me in the studio, our guests from the Productive Health Uganda, young people who are every day preoccupied with doing something to advance issues of sexual and reproductive health in Uganda and beyond. And we believe that as Reproductive Health Uganda, there's an organization, they've done quite a number of things, including work in different fields in this sector. And that's why we have invited them to share with us what they are doing, but also to learn more about what are the success stories, but also the challenges and how the younger people want to are getting involved in the day-to-day work of the organization. With me in the studio is Martha. I'll give Martha an opportunity to introduce herself on my right. And on my left is Huzaifa. Huzaifa will also be given an opportunity to introduce yourself. I want to welcome you to this podcast where we shall be sharing and discussing what you have done, what you are doing, and what are your aspirations around sexual and productive health in relation with climate change. Martha, I invite you to introduce yourself once again as we start this podcast.
Okay, thank you, our moderator. My name is Martha Mugabe. I work with Reproductive Health Uganda under the Youth and Gender Department. I'm also a social worker by profession. Thank you for having us here.
Martha, we welcome you to this podcast and we look forward to hearing and learning from you in terms of what you want to share with us. Huzaifa, you can go ahead and share, introduce yourself.
Thank you so much, Isaac. First of all, I would like to commend you for giving us a platform as this one, as young people to share our experiences, especially being in the field that we're in. My name is Josepha Kiggundu Sali. I am a youth advocate at Reproductive Health Uganda. I am also, I support the advocations and communications department, or advocacy and communications.
Okay.
Glad to be here.
Zaifa, you are most welcome to this podcast, and we look forward to hearing from you in terms of what you are doing in this area, and we welcome you once again.
Thank you.
Martha, we are aware that according to Sustainable Development Goal 13, which focuses on climate action, we believe that young women and young girls specifically are really facing the challenge of climate change through different ways. We would be very happy and excited to learn about when we talk about this burden, the challenge young women and young girls are facing. Somebody would love to know what are those real experiences on ground.
Okay, thank you so much. So, climate change affects young women and girls in very many different ways. First of all, young women and girls don't have access to clean water. An example is during, let me say, their menstruation. If they do not have access to clean water for them to bathe, you're going to find when they are getting infections, where you find they're not washing. Maybe if they're using reusable pads, they're not able to access clean water to wash these pads, so they're going to get infections. And then also when it comes to the caregiving role, you find a woman has to prepare food for the child. She has to have water for the children to drink, to shower, and then there is no access to this water, probably because there is a flood that happened, and then the water is contaminated. So they don't have access to clean water, but also things like young girls are forced into early marriages, where you find a disaster has happened, there is no food at home, property has been destroyed, so the only alternative a young girl has to do is probably to get married, so that she has a home to live in, she has food to eat. Or you find a young girl is they are affected by early marriages, where teenage pregnancy, where in instances where they have to go and get water from very far areas, so the distance between her home and where the water source is sometimes is not safe. So while she goes to fetch water, sometimes they are raped, and you find she has fallen victim of a teenage pregnancy. Yeah, so those are some of the challenges that affect young women and girls. But also, let me say the heat waves, like we've talked about it before. The heat waves affect the pregnant women, where you find she may experience a miscarriage or a stillbirth. So yeah, those are the different ways in which climate change affects young women and girls.
Wow, this is very disturbing, because when I listen to you, I find myself really weeping in a way, because these are very serious challenges, and definitely which would need action or to be worked on by different stakeholders, or basing on their responsibilities, like government, but also the international community under the climate change framework convention on climate change, where we know that the developed countries need to commit climate finance to be able to support action aimed at reducing some of those challenges. And indeed, we really want to look at how best we can be able to work together within the framework of different stakeholders, the private sector, government, civil society, the academia, religious institution, in terms of confronting this challenge. But I think we thank you for sharing those insights. Huzaifa, I know that you are working within the communication and advocacy department of health, of reproductive health Uganda, HRU. What are those advocacy issues do you keep on seeing or imagining that you would want to amplify further, so that the voices of those who are impacted by climate change, especially young women, is well amplified? What are those issues as communicated, and what are you doing about them?
I think, first of all, the issue of lack of access to information. This is seen as something simple, yet at the same time, it can be something that changes the entire outlook of somebody's life, right? Majority of the time, we find that most of the affected young women and girls do not even know that they have rights to certain things, right? So this in the long run it's a hurdle for us to communicate something that somebody isn't exactly aware of, right? At the same time, you can't also advocate for your rights as a young girl if you do not know where to go to, or at the same time, if or you can't even hold the responsible, say like agencies accountable if you do not know what you're going to fight for, right? So I find that the biggest issue has been lack of access to information, accurate and comprehensive information. At the same time, I think lack of accountability by different players in this, should I say, field. Because I don't know, in Uganda, it's a bit of a layman's land. You find that so sometimes people are supposed to do play various roles in this fight. They don't really do what they are supposed to do.
They don't take on the responsibilities, which is given to them by the different legal mandates or frameworks.
Yes.
And you mean they leave things at a laissez-faire level, whatever happens, nobody is bothered.
Yes.
Of course, that's not what we wouldn't love to see.
Yeah.
We would love to see how we can be able to work together with the different stakeholders to take action or to confront this issue. But yeah, go ahead.
I like that you've talked about that because it triggered something me when I realized not really involving local leaders. I think it's easy for us to sit on round tables this side in Kampala and develop all these things that we think might be amazing ideas and plans for people that have been affected by various climate shocks and events. However, if we leave out the local leaders, how are we going to know exactly what the pressing points are for these people that we were planning on advocating for, right? So I think establishing direct and consistent communication and engagement with various local leaders, I think this can go an extra mile when it comes to advocating.
Yeah, but also when you look about local leadership, you have also reminded me of the role of local governments. And when you talk about local governments, I mean the district local government, but also the lower local government, which is the sub-county local government. We need to see how do we work with them to make sure that as they do their budgeting processes, these issues of sexual and reproductive health are put on the agenda and they are put in their budget so that we stop at the level of complaining that there's no finance, yet there's an opportunity for us to put that issue on our agenda at the district, on our plans at the district local government level. And of course, again, at the national level, there is also need for engagement so that some of these things we come up with a cost implication on what it means for this work to be done or to be supported. Without planning and budgeting for the work related to sexual and reproductive health in Uganda and beyond, you may find that it might be very difficult to attract funding or support from even the development partners. So I really appreciate what you are talking about. But also, as a young man, what kind of challenges or issues do you see from the perspective of young boys, sexual and reproductive health issue that you are facing amidst the issue of climate change?
Wow, thank you so much for that question. I don't know. I think, once again, I think this is something that might not really be taken seriously. I think this conversation is under-discussed, right? First and foremost, as a man, me saying that in itself says so much because we come from a country that is rich in tradition, cultures, and all these various norms, right?
And highly patriarchal.
Very.
Highly patriarchal in a way that men are seen to have a lot of powers
and dominance,
decision making, which again disadvantages.
Of course,
women.
Because that can trigger. Also, yes, some of these issues are cross-cutting, right? One thing that happens this side can end up triggering a whole avalanche of impacts on another gender, right? But at the same time, that misconception and norm of men have to be dominant or men hold the power. I don't know. I feel like it triggers risky behavior in men, and this in return can expose us to various sexual reproductive health, or sexually transmitted diseases, STIs, HIV, and all these other things because you have it in you. In fact, the Uganda call it oxagelata, right? Things like that.
Basically, if I can translate it, that a man has the right to go out there and do what they want and
Pretty
come back
much.
without any kind of blame. No?
Yeah, without having a flinch. This is how girls end up being raped. This is how girls end up with unwanted pregnancies because somebody told them something and then they did not. And from a young person's perspective, when I look back, I lacked comprehensive sexuality education as a young boy. Majority of what I got to know, I either learned from a movie or from a conversation with friends. And luckily, I had a father who was active and present in my life, and obviously from my father. However, not everybody is going to be as privileged as I was, right? So
this is a very good lesson. If I listen to you carefully, the role of parents, and specifically for what matter, your father really played a very critical role.
Yes.
But we know that within this era, also mothers can equally play the same.
Of course.
You know? So what I'm hearing from you is that as parents, we need to be at the center of guiding our children.
Yes.
In terms of letting them know this knowledge around sexual and reproductive health related, but also based on our culture, that education is a little bit hidden away from us because these are issues that you don't need to talk about in public, and that again that creates a bigger challenge.
Even stigma as well, because anybody that talks about sexual reproductive health is usually looked at as somebody that's not really, that is immoral. Usually these conversations stir emotions that are uncomfortable for majority of the Ugandans, right? And you find that the more we do not have these conversations, misinformation, misconception, this usually ends up constantly being discussed amongst young people, right? In one of the activities that we had in Kalangala, we did an activity that was human-centered design.
That's under
Reproductive
Health Uganda.
Yes. We have one of our approaches is the Choto approach, where we have different community members be a part of this Choto, and it's a fireside conversation, essentially.
Yeah, if I can clarify, when we talk about Kyoto, you don't mean in climate change we have the Kyoto Protocol, which is a city in Japan, which people relate to climate change. But for this matter, Kyoto is a local kind of name, which means literally that you create a fire camp where you can be able to discuss some of these critical issues. You sit around and be able to open up and, be able to share and discuss these issues.
Yes. So one interesting thing was there was a mother, and she was actually one of the local leaders, and she had a child right next to her, right? So we made sure we have different age groups. Anyways, so she shared something that triggered a response from the mother that we didn't really expect. Anyways, this just goes on to show that there is so much we need to do. And luckily enough, we have various civil society organizations that are trying to fill the gap in information. And of course, I think, once again, everything is crowned up by societal norms, okay? Because I might be going through something complicated as obviously as a direct result or impact of climate change, but I can't exactly talk about it. For example, my girlfriend might get pregnant, right?
Yeah.
Imagine somebody in a one Seboduda or Kasese, right? The hospital has been washed away by the landslides, okay?
Yeah.
I was sexually active. This girl ends up getting pregnant. Okay. I do not know exactly what I'm going to do. We don't really have roads. We do not really have access to food. I generally do not know what my next move is.
And actually, the service, the sexual and reproductive health services are not easily available, not even the nearest hospital, but even when you want to commit, don't have the transport to be able to move where you can be able to get this free, and which is not very common. in
Of
many
course.
in many health centers.
Of course. And if things are a bit that complex here in Kampala, imagine how dire the consequences are outside Kampala, right? I mean, it's easy for us here people don't really understand the gravity of this situation. But yeah, so that is going to affect my mental health, the stigma that comes with it, because if I got an infection, I got somebody pregnant, like all these various things, how am I going to talk about it if I worry I'm going to be laughed at? Because what do you mean? You're a man. Like, this is a conversation you shouldn't be having. What do you mean family planning?
In other words, which is very, very interesting. In other words, you die silently because society
Yes.
does not expect you to come out
They would
and
rather bury you than help you.
wow. They don't expect you to come out and say, "Hey, this is happening. I need help." Or you have to fight out your way, but you have to do it silently, which is very, of course, very unfortunate.
Of course, why should I? Yet there is people that I can talk to. There should be measures for me to take to ensure that my mental health is right, that my sexuality, generally my entire life is healthy and moving like it should.
Wow, Huzaifa, thank you so much for sharing with us those discussions. I've really discovered something which is very interesting. That as much as we talk about climate change, the nexus between climate change and sexual and reproductive health, we needed to really also think about how the boy child or how young men are being affected in this discussion.
Yes.
And you find that we need to actually bring them on board. Because as Martha was talking about on the issue of rape, other pregnancies, the question is, who are those impregnating these young mothers? And that's why we need to bring young boys, young men at the center of the discussion without leaving them behind. Otherwise, in the long run, you might be solving one part of the coin, which isn't actually the thing we were looking at. And I think, Martha, do you agree with us on that?
I do agree because we saw in COVID where the rates of teenage pregnancy went up, and yet you would think that since children are home, they're probably protected. But we saw that even their uncles were the ones perpetrating, raping them. Some of them it was let me say their fathers, because you would think that, oh, they're in school, it is their boyfriends that are causing these teenage pregnancies, but now even the people at home are the ones, the cousins, the uncles, the people there.
And that showed the vulnerability, and therefore the need to support them to come out of that.
Yeah, that is why
not only from home, but even at school and wherever they are at all times.
That is why when we are having these conversations, it's good to have the male involvement, to have the men, both the fathers, every kind of man in this conversation, so that they're aware of their consequences, of the consequences of their actions.
Okay.
Yeah.
Martha, from your opinion, what's not being done to improve the situation? Because we have done a lot of work, but what is that critical action that you think will trigger an avalanche of benefits that will halt this or stop some of the challenges you have talked about?
First of all, doing a lot of community sensitization, talking to the community about the effects of climate change on the young women and girls.
Yes.
Having this, also having male involvement, having men join into the conversations, but also doing climate change financing could help to reduce on some of these challenges. If we have, let me say, climate change financing, you're going to find people are being relocated. So the number of people being affected by floods, being affected by landslides are going to reduce. Because if you're telling someone, oh, we can relocate you to this area, they're going to move. but some have no plan B. That is where their ancestors have been buried. That is where their parents have been buried. So telling them to just relocate is hard. But if you're compensating them, it is easy for them to relocate. So that is something that we need to work on. But also having these conversations more often, having a lot
access to information, basically. As they say, information is power. Or knowledge is power.
Yeah.
So with this access to information, people will be aware of what they should be able to do, and the different stakeholders should understand and appreciate their laws, responsibilities, and therefore it will take us to go to another level.
Yes. So yeah, having these conversations more often, but also how do they put it? When it comes to I think the writing, how the communication is also passed.
Yes. The issue of communication, the way in which we communicate.
Exactly.
The channels of communication.
Yes.
Are we targeting those who are most in need of this information? Because you find that most of the younger people now are on social media. And so if you are calling for a meeting, in a village meeting, for them to go there, you may not see them.
Yes.
But if you called for an online meeting or you shared something through social media, they can be able to get the message. So I think, channels of communication is very
If you're talking to the people in the grassroots level, it would be nice to have maybe radio messages going out. If you're talking to people this side in town, using social media, using Twitter, where most young people are, would be something nice for them to engage. But also inviting them to let me say, when certain policies are being passed, young people are not involved. It's only the high-end people that are involved. So having these conversations with the people that are affected, the young women and girls, having them in these rooms and having them actively participate in these conversations and hearing their views would be something great to help curb the climate change effects.
Okay.
Yeah.
Okay. Thank you, Martha, for that. And Huzaifa, you have heard from Martha when she said definitely access to information is really very key. And as a person working in the advocacy and communication department of health and productive health, how do you make sure that you work in tandem or in collaboration with the stakeholders? How do you make sure that information reaches those in most need of it? What mechanisms, strategies do you use to make sure that those who need this information really get access to it in time?
Okay, thank you so much. First of all, as reproductive health, we invest in research, scientific research, because before we pass on any information, we need for it to be factual. Okay? One of the biggest issues and challenges we have is misinformation, right? There is information, but then there is misinformation. And it's very hard sometimes for people at the grassroots to sort of understand what the difference is between the two. Oh, okay. So after we invest in this research, we usually use various channels and approaches. For example, we use toolkits and some things like position papers. And we usually also use, we capacity build, first of all, people at local level, right? Luckily, we usually have focal persons in each district where we implement. So we use these people to cascade the information that we have, not just give it to anyone. It needs to be tailored, first of all, to the community that you're going to pass the information on. Because you find that the issues affecting people in Kasese are not going to be the same issues affecting the people in Karamoja, in Lamo, and of course, the language.
Yes.
Okay? You cannot be out here using complicated English words to people in a remote area in deep, like northern Uganda. That wouldn't make sense because
or even in central Uganda, there are places not everybody knows English. I mean, even
of
if
course,
they know, this is a foreign language. So we needed to translate to very local context under which they should be able to understand. And I think it's not a sin or it's not bad to make sure that deliberate strategies are put in place to make sure that people get this information through their local languages, which they really understand best, and they can be able to take action.
And when you said that, I might sort of like deviate from what I was talking about earlier on, but I think that's also a gap that we have with the national health plan. I also think it needs to be tailored specifically on local level because once again, different parts of Uganda experience different weather patterns. Okay. And I also think we need to invest in one of the meetings that we had with Mary Stopes and Ministry of Health when we were coming up with implementation activities. One of the key focuses was translation of literature to make it more easy to make it more comprehensible for people. And obviously, it's going to be much more easier to implement something that you understand.
Yes. Okay. Thank you so much, Uzaifa. As we come to the end of our discussion, Martha, how do you see what should be the role of young people in all of this, whatever we have talked about? Do you see a critical role that young people, both men and women, should be given space to play as we advance issues of social and reproductive health in relationship to climate change?
Okay, thank you. I think one of the biggest roles we should do is looking for information. Right, as much as the government and the different stakeholders are supposed to give us information, it is really critical for us as young people to get the information, to look for the information from the different places. The internet has a big pool of information. It has documents that people can read about so that they get knowledge on different aspects of climate change, but also I've realized from the conversation you haven't talked about people living with disabilities.
Yes.
So people living with disabilities are also majorly affected by climate change. So also as young people, getting ways of helping people with disabilities. Let me say that you'll find there is a young woman living with a disability. She's probably pregnant. Let me say a flood has happened, or she's or a landslide has happened. So her getting that help is something that would be.
So Martha, I'm learning about from you that we must make very deliberate strategies to bring on board the youth in this conversation, but also the youth. There are two categories of the youth. That the youth who are already in the category of women who are married but they still need support. They're in that age which is very productive. So we can also refer them as women because they fall under that category. Then we have also the category of the young mothers, those children who actually produce children, which if I can
yes,
yes, which is again another very vulnerable kind of group. Then the other group is people with disabilities.
Yes,
that also need special attention in case if disasters strike, and this can also include younger people who are probably, for example, they are pregnant on the side, or if they are girls, and they can't evacuate themselves, or they are single mothers. In a way, they can't provide for themselves. And now this brings us to another critical aspect on how do we work together to end poverty, because poverty at the household level, issues to do with livelihoods, we need to think about how do we invest in those areas. And when we talk about climate finance, that's the finance we need to invest to end poverty, but also to improve the livelihood alternatives and solutions at the household level, so that as communities come out of poverty, their level of response to disasters will improve in a way. And if they have access to income, their level of education will improve, and therefore their level of appreciation in terms of some of the responses, the mitigation responses or preventive measures will be highly appreciated. But of course, above all, once most of the younger people are in school and they are improving their knowledge and skills in colleges, then that will take away other pregnancies in a way, because they will be preoccupied with education and
the reproductive age will be delayed.
The reproductive age will be delayed, and that to the advantage of not only the economy but also themselves,
Yeah.
so that they can benefit in the long run. Huzaifa, do you have something to tell the global audience about what you think is critical and should be done to advance the boy child aspiration as we talk about the topic of the nexus between climate change and sexual and productive health issues?
Yes. I think, first of all, I would like to commend every organization and actor that's playing their role in advancing rights for women. However, you realize that men are usually left behind, and you can't really blame them because women are usually the most susceptible to suffer the impacts of climate change. Right. I think we also, as much as we're paying more attention to women, I think we need to at least also pay some attention to men's needs. As reproductive health, we have a male engagement forum. Every time we have activities, we specifically engage men to bring them on board because we find that most times men are the perpetrators of all these things, right? Child abuse, early marriages. So the more we sensitize and educate them of what their role is as players in the sexual reproductive health rights field, I think that would make it much easier. But at the same time, I think government needs to be held more accountable because you find that
So the issue of accountability comes in.
definitely because you find that most times men who abuse girls, they're arrested today and the following day they're out.
Yeah.
Right? So this is something that's going to keep occurring over and over again until we actually put up measures as a community first, because it usually happens within us, and then obviously on national level as well. I think. Oh, I think we also need to involve religious leaders because these are people who hold much value and respect amongst our communities. So one way or another, I think they can be able to help us change the narrative.
Yeah, Zaifa, as you talk about religious leaders, it reminds me of also the role of cultural institutions.
Oh, yes.
We have the kingdoms, we have the
Yes.
chiefdoms, and I know that for the Central region, the Buganda kingdom, Busoga kingdom for in the eastern, and other kingdoms within the country, they are very interesting areas of engagement, and they hold a lot of influence on their communities, on their people, and therefore we should take advantage of some of the positive
Yes.
cultural norms, values that we can be able to really advance and take action on this issue. As we summarize, Martha, what is that one thing or two that you feel that is not being done and it should be done to advance the plight of young women in relation to the challenges at hand, which we are talking about?
Something that should be done that hasn't been done.
Yeah.
I feel like as a country we are evolving. We are at least having efforts somewhere. They may not be as intensified as we want them to be.
As adequate as we may want.
Yes, but at least we have efforts when it comes, let me say, to access to family planning and contraception.
Fragmented efforts anyway.
Yes.
They're there somehow.
Yes, when it comes to access to family planning and contraception, we have at least different actors putting in some energy where we are having outreaches to bring the services close to the people. When it comes to sensitization, it may not be adequate, but at least it is there somewhere. Somehow we have different actors in the different communities. So I cannot point out that there is a specific thing that is not being done.
Or you can talk about a scale up that needs to be scaled up, something that needs scaled up.
Oh, okay.
Yeah.
Let's say when it comes to sensitization, it needs to be scaled up. First of all, to be, let me say, the different for it, let me say sensitization to be done in the different local languages, but also to bring it to the grassroots level. And then also a lot of research needs to be done on ground. Let me say when it comes to climate change, to understand how exactly does it affect the pregnant women, not to just go with the assumptions that are there. To, get on the community, get the correct information from the young women and girls, but also when it comes to let me say, if it is, let me say things like flooding, landslides, heat waves, go to the different communities that are being affected by these climate changes, and understand how are they affecting them. How can you help them? So I feel like we need to get a lot of information on ground, not just moving assumptions or comparing what is happening in Uganda to the other countries. So doing a lot of research, doing a lot of sensitization, and also bringing services closer to the communities.
Okay, very interesting. Context-based, scientifically proven kind of information
Yeah.
should trickle down to the grassroots for people who need it most, and therefore, by doing that, we shall be able to know to advance and work on these issues, these challenges. I want to thank you, our colleagues, our visitors from Reproductive Health Uganda. And this podcast is being brought to you by Ecological Christian Organization and in partnership with the Marathon Advertising. We believe that by bringing different experts together and being able to have these kind of discussions, we shall be able to learn more and also see identify the gaps that need to be addressed. And we know that we shall be contributing to this global agenda of fighting the impacts of climate change and making sure that we leave no one behind. We thank you for joining us and for listening to us and watching us. And we look forward to working together to be able to advance these issues in future and later on, of course, when we are able to meet and partner specific programs. I thank you.